Yes, guys, thank you again. Don't forget to subscribe to the channel, and the videos will be here for you. Not just that, you will be supporting and our mission to read. Reading is fundamental. Reading is fundamental. Is fundamental. All right, guys. Like it's so important. Reading is so important, and this is where we not only develop our vocabularies, but also will and make ourselves aware of what's going on. So, press progress. Thank you for this article written by Mitchell Thompson. So, Doug Ford is looking to cut costs in healthcare staffing. That's crazy at this time. So, documents from Ontario Health show Doug Ford's cabinet mandated the so called super agency to develop performance measures to find cost savings on staffing and equipment across healthcare. According to Ontario's chief medical officer, the province healthcare system is currently under extraordinary pressure as pediatric hospitals, intensive care units, and emergency departments are overwhelmed with patients. For years of warnings about bed shortages and staff shortages, and that is so true. There's a great need and a great demand for healthcare workers right now. And this is crazy if this is for real. But according to the business plan for Ontario Health, the super agency created by Doug Ford in 2019 to find efficiency in health system, the system is actually spending too much. In the agency's more recent business plan, it boasts that it is working to quantify value, add opportunities for health system, and identify efficiencies, savings, and value creation. It underlines that this cost-saving program is to be done in collaboration with the ministry. In the near term, this is to start by saving funds in areas related to um, hemodialysis. I think that's the best I can do. Sourcing and acute care documentation, but more broadly, it opposes to develop a vendor scorecard program that focuses on both service and goods to monitor costs. A scorecard? Just, just come on now. Just come out the closet and tell us that you're gonna be implementing the chip. This is how they're gonna bring in the chip. Come on now, get out of here. A scorecard, and then is that scorecard gonna be embedded with the RFID chip? Anyway, Angela Priokinen, a registered Priokinen. Hopefully, sorry if I messed this name up. A registered nurse and first vice president of Ontario Nurses Association said the language is deeply troubling for patients and workers alike. This is not the time to be focused on cost savings. Pre P, I'm gonna call it P. P told the press progress. This is the time to be looking at immediate action to retain nurses and healthcare professionals. We cannot have the lesser focus to be on anything other than rebuilding the capacity. And cutting further comes with big risk. It's a vicious cycle. And that's true because the healthcare is not paying that much to begin with, right? So if you're going to be looking to cut costs with what? When it comes to supplies and staffing, what? Then a lot of people are going to be turned off and go to another sector when this sector is very much so in need for people to stay in it. We're already seeing an influx of people coming into the healthcare sector and go and leaving the healthcare sector because it's not designed for everybody. Not everybody can handle taking care of the vulnerable. Not everybody can do that. Not everybody's stomach can stand that, and not everybody's psyche could live up to that day-to-day lifestyle of working within the healthcare system. I should know. That's the way I work. So for them to talk about cutting is bullshit. Sorry, my language. So anyway, when you're working with skeletal staff, you can't provide care to all people who require it. Prio Cannon said, "It's really scary time." Among the deliverables quietly mandated for the agency last year was a plan to develop performance measures to track new savings on cycle time, or the time spent per patient visit and spend per full time equivalent or spending on staff. So now, so what that means is direct and indirect care. So they want to basically split up the payment. So they're saying if you're not with the client, directly with the client, if you're let's say if you're with a client directly, you get full pay. When you're not with the client directly, but you're still at work, they're gonna cut the pay down to something else. So for instance, if you're getting $20 an hour fully, you're you only receive that $20 an hour when you're with the client, when you're taking care of the client, when you're helping with the care plan for the client. That's the only time that you get that $20 an hour. Being at work, still being at work, as soon as you leave that client's door, or as soon as you made that report on your app, that time from $20 cut down to $15 because you're not with the client. What? I'm still at work. You know what I'm saying? I'm still at work. I'm still on call. I'm still, like I'm still doing healthcare. I'm still at work. I don't even understand that, right? In a time where we need people, I think the government is just stressing for money. I think that's what it is. So all these promises that you've made, Doug Ford, you're not going to fulfill them. Even the promise that you made about Timmins, investing in Timmins and building that, rebuilding the highway and extending the highway, opening it up for because going after you pass Sudbury, it's all 2 lanes. It's 2 lanes all the way up to Timmins. This is Canada Trans Canada Highway we're talking about here. Only 2 lanes. And for folks that are living in Timmins and folks that are living outside of Timmins who wish to get into Timmins, you know, Ford claimed that he was going to invest in the northern train to go up there for trade and tourism purposes. You think that's going to happen now with this sign? You're literally willing to cut the budget on healthcare. If you're going to do that, that should be their last resort. This is healthcare here we're talking about. They're losing a lot of money. They don't have no money, and this is what's going on when government don't have no money. They start cutting necessities. So anyway, so quote, develop performance measures that focus on operational excellence, such as cost savings, patient outcomes, cycle time, spend per full time equivalent, quality, and provider satisfaction. Joel Usher, chair of Ontario Public Service Employees Union Ambulance Division, said the around full-time equivalent spending language is also troubling. That's what I'm talking about. Once I'm at work, I'm at work. So you're telling me, all right, for someone who's a paramedic, they only make, let's say they make $30 an hour. I don't know how much they make, but let's say they make $30 an hour. Only time they're making that $30 an hour is when they're on call for that emergency call when they're seeing the patient. That's the only time they get paid. So when they drop off the patient at the hospital or go back in their vehicles, they're not getting paid at $30 an hour. They're gonna be getting $20 an hour. That is foolishness. As soon as I come to work, I'm at work. This is a vulnerable sector here we're talking about. And here's his language. This is the language. This is a language this man is talking. This man, that's what I'm saying. Politicians, man, you can't trust them. In the case of paramedic services, employees often use a casual part-time, full-time model. Use Usher told a press progress, finding savings on spending per full-time equivalent. That is cool. That's true. Because most jobs they say you're full time, but when you check out your hours, you're not really full time. So you're gonna have to go get another job. You might be, I guess, full time is classified over 25 hours a week. So once you're making over 25 or 22 hours a week, you're full time. That's foolishness. Full time should be 40 or 37 hours. So finding saving on spending per full-time equivalent for this union means the employers make efforts to realize cost savings through the deployment of casual part-time workers. These workers enjoy far fewer benefits and have far less job security because they typically work under 6-month contracts. Usher added that's which is crap because most of I'm speaking for myself anyway. One of the reasons why I came into healthcare is because I want that job security. Another reason, my first reasons for coming into healthcare is obviously I've always had the desire for giving back to the community, especially to the vulnerable. I feel like as if it's a blessing for me to be in this position. I feel like I'm gonna be so much wiser, so much appreciative for life and all my blessings, and literally in return bring that back to the community and give what I can, according to the care plan to that vulnerable personnel, right? So listen, these are deep desires here for a lot of people. It's not just for me. As I said, it takes a specific personnel to step into this role. Not saying anybody can't do this position, but not anybody gonna wanna do this position. You understand? So Ford is walking a thin line. Because as soon as you start using languages like this and you're belittling the work of the frontline workers and other healthcare professionals, then you're brewing something else. Because you don't want to take the desires out of the employees, right? You don't want to do that because what do you think is going to happen? People are gonna move on. Nobody want to live in stress. And when you're in a vulnerable sector, the stress levels are very high, or can be very high, because you're dealing with vulnerable folks. So, still quoting, these workers enjoy far fewer benefits and have far less job security because they typically work under 6 months contract. And that's why when you see a hospital is hiring, they most likely hire a part-time. And it's hard to get into full-time. And you have to do everything. You have to jump through a lot of holes and loops to get into that full-time position. So Doris Grimspun, CEO of the Registered Nurses Association of Ontario, said the language in the documents is shocking. The government's quote, the government needs to decide if it wants to continue to damage the healthcare system by depriving it of the human resources it needs, Grimspun told Press Progress. Quote, if we don't have competitive compensation and competitive benefits alongside less severe and heavy workloads, patient will suffer the consequences because nurses will continue to go somewhere else. Same thing I just said. This, so end quote, this, Grimspun said, is part of a pattern for Ontario Health since its creation. So basically, this is the same language since its 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 implementation. This is downloading the responsibility of the government onto an agency. That is true. And listen, you don't want to do that. You do not want to do that because some of these agencies are not set up properly to take on such responsibilities. So what that's gonna happen? What's gonna happen is what Grimspun and I agree on. People are gonna go elsewhere, and that's sad because 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 you're dealing with vulnerable folks. If you miss one day of work, that's somebody going without care, or that's somebody having to have a hard time that day trying to find care, or you know. So for agencies that are not implemented properly when it comes to workforce, long term care, you know, such as long term care and other small agencies under the Lynn contract, it's gonna be a disaster. So anyway, this is the downloading the responsibility of government onto an agency. Grimson said it sets the universal healthcare system up to fail by design. Literally. Neither Ontario Health nor Minister responded to requests for comment from Press Progress. Global News reported last August that Ontario's former health minister explicitly mandated the agency to cut costs across the board. As part of the Ontario government, agencies are expected as part of the Ontario government. Agencies are expected to act in the best interests of Ontarians by being efficient, effective, and providing value for money for taxpayers. And you know what? It's not going to happen. Some agencies is all about the money. I'm sorry to say, some of them don't give a rat's ass about these patients. And that's sad because it brings tears to my eyes. Ford, you better know what you're doing, man.